Hey everybody, this is Dr. Ben Pearl with FitFoot U. So today we have a peroneus brevis tear, an old tear, on a patient of mine that does equestrian. She does horseback riding. So she came in with a recommendation to get surgery to repair the peroneus brevis tendon, reattach it. When I did my clinical exam, her pain was up higher in the ankle area where the peroneal muscle goes around the malleolus. Turns out from the MRI she had an accessory peroneal muscle. That's where her pain was. So we did a treatment of electromagnetic therapy. We did 3 of them, and she felt decreased pain at that peroneal notch area where the accessory peroneal muscle is. So basically, in that groove of the ankle where she was having the discomfort, by applying the electromagnetic therapy energy, it was able to reduce that inflammation. As she did more progressive activity, the pain then returned to more of the base of the 5th metatarsal where the peroneus brevis inserts. So the conundrum, what to do next? What I did next, I did a therapeutic injection with placenta tissue. It's a liquid. We did a small bolus, about a cc. We then did an electromagnetic therapy treatment right after. She also has a smaller gauge home unit that we used, and now we're going to get from the patient her experience through this whole process, what she's able to do now and what she's still limited in. First thing we'll do is we'll talk to our patient. We're going to get a close-up of the machine first. So the unit itself looks like a box. We can go up high on the unit. I'm just going to mask up here so I can turn the machine out just to show the display. And then while this is warming up, what's been your experience? What have you noticed with, just daily activities and horseback riding?
When I ride, which it used to be, when I used to ride, it would get to the point where my ankles would completely turn in and I couldn't move them. But now when I'm riding, I don't even really notice. There's a significant decrease in the pain where I was getting here.
Mm-hmm.
And now it's even afterwards. I don't have any of the pain that I was having, where to the point where my ankle would completely give out and I would end up falling due to that.
Mm-hmm.
So it's definitely helped a lot with the pain here. Still a bit limited with some walking because of the tear here.
And you mentioned prolonged standing.
Prolonged standing. My job, I work at a kennel, and I'm standing for.
Do you have to corral in the dogs, or?
Yeah, I bring the dogs out, walk them out. I'm
even
standing,
that activity,
walking.
if they're big husky dogs, I can imagine that would put a little traction
Yeah,
making it a little challenge. So we also gave it one of those tri-lock braces, which I would imagine you want to keep continuing to wear.
Yeah, I use that when I have any flare up after riding, if it hurts a lot more. But
just so folks can see at home, can you show the unit as it would be applied when we turn the energy? It makes a ticking noise, so we don't want to turn it on just right yet. But just get a close-up on the machine, if you could, the display panel, so people can understand what a larger unit looks like. And it has a detached device that you can do it unattended, but we like the attended when we want to get both on the top and the bottom. So because you're here and because you've been good about sharing information, we're going to do 15 more minutes with another super transduction mode, where it's going to feel a little bit different, more of a vibration, less of that kind of prickly sensation.
Mm-hmm.
So we'll get started with that. But overall, in terms of functional and pain, if you had to put a percentage, where are we from where you started? I guess that's what people would want to know.
I would say, in terms of
And
this
it could
pain
be function
here,
and pain. Yeah, good.
in terms of this pain here, almost, I would say we're at 85-90%.
Okay.
Better.
And then in terms of the actual area closer to the tear?
That one is still kind of more of the, say, 35% range. It's still work in progress, I would say. It's not as...
So we got to get you so your prolonged standing is improved. And then at least I'm pleased to hear with equestrian where you are going up and out, and I would have thought that put traction. But you said an interesting thing. you said that when you moved your baby toe,
Yes.
that seemed to activate the peroneus brevis, and that was, and in standing and walking, that's what's causing the discomfort.
Yeah.
So to the extent that we can kind of keep that immobilized with weight bearing, even if you have to go to a boot for a period of time, that might be the better part of valor.
Yeah.
Yeah. Okay. Well, let's wrap it up here on this episode. So I think we've got some ideas here that are helping her. I think I want to see a little bit more immobilization, just so that we're protecting what we're doing. And then we'll have an update, but I am pleased that at least you're able to get back to, the sport that you love, equestrian. So till next time, this is Dr. Ben Pearl with Fit Foot U.